Facebook. It's all about men's health. Dr. Sean Troy here. He's a doctor. The doctor is in. It's all taking place here on YouTube. For Let's Talk, and of course, join us now. A conversation with Dr. Sean Troy. There's a doctor, a herbalist, and a whole lot more. It's all about men's health on 92Q.
All right, everyone, we're about to do a radio interview with 92Q here in Nashville, Tennessee. My host, EA Ernie Allen. We're going to talk about men's health today. So join us. You can post your questions in the comment chat section, and then we'll answer those as well. Yeah, bring it in. Yes, sir. Yeah, great. Sounds great.
So now,
yeah, where is the knob?
it's right here.
All right. All right, good deal.
Shit.
Check 1, 2, 3, 4. So not as rigid a schedule as radio.
Right. Well, you can say anything you want to say.
All right. You know me.
Yeah. Right. And thank you so much for joining us as you do for each and every episode of Let's Talk, now live on YouTube. And go to 92Q's Nashville's YouTube. Also live on Facebook. Go to Let's Talk Nashville. Let's Talk Nashville. Post your questions, your comments, any questions at all you have. We are guest aboard the program. And you can also call us at 615-737-9292. It's all about your health, and June is all about everything, it seems. It is the month that we go to daylight saving time. It is also Father's Day month. It is also Juneteenth month, first day of summer month, just everything. Also, June is Pride month for the LGBTQ plus. It's also Gemini and Cancer. You get two zodiac signs. I don't know why, but that's the way the hand is dealt. It's also about your health, and your health is your wealth. It's all about your health. You cannot plan to do anything in life. You cannot go on vacation, retire, whatever you want to do. You need to take care of your health. June is also Mental Health Awareness Month for men and overall health. If you have a health question right now, 615-737-9292. Our guest is Dr. Sean Troy. He is, of course, a pharmacist, an herbalist, and the owner of Troy's Discount Pharmacy. Good to see you again, Doctor.
Great to see you, sir.
All right. How have you been?
I've been pretty good, man. How about yourself?
Close to that.
Okay. All right. Yeah, I've been pretty good. Thank you for having me on.
Yes, sir. Glad to have you here. Now, you're a pharmacist, you're an herbalist, but we want to talk about health. And, of course, hopefully we get a whole flood rather, of phone calls and questions at all.
All right.
So thank you for being here. You're also the host of Pharmacist On Call on one of our local channels,
Channel 5 Plus. Yes, sir.
How's that going?
Pretty well. I'm in my 11th season now, so the viewership is really good. Participation, I've got a good following.
All right. It's been a while since you've been here as well.
Absolutely.
Where do we begin when we talk about men's health? Is it more special than women's health, or just as important or less important?
Yeah, I'd say we do need to begin with men's health. We would probably start with the major things that affect men. Certainly, it's going to be, hypertension, diabetes, heart disease, obesity. Those are going to be your major issues that contribute to an early demise. So those are things that we generally try to get on top of, and then you get down into the lifestyle stuff with the erectile dysfunction and all of that. But first, we want to improve your quality of life by getting you better in terms of the major things that affect you.
Right. Why is it so important that we concentrate saying that June is Mental Health Awareness Month?
Well, Mental Health Awareness Month, everything starts upstairs. And so that's important as well. If your mind is not right, you're not going to have the motivation or understand the importance of why you need to do it. One of the things I talk about, just in terms of being a father, since we just celebrated Father's Day, is the number one P of fatherhood is to be present. So that you can do the other things such as preparing and parenting and protecting and providing. But it must start with you being present. That means you need to be aware of your health and improve it as much as possible.
Men not taking the time to go to the doctor like women. That could lead to some other problems.
Absolutely. Yeah, you must know your numbers. You must know where you stand so that you can do something about it. And I frequently tell my patients, a number of them, men and women, they just want to jump right to this is what's going on with me. And I'm like, no, sometimes we need to go to the doctor, see what the labs say, because I don't want to shoot in the dark about what we're trying to work with. So, yeah, it is important.
Always go to your doctor for a checkup. How often would you say?
At minimum annually.
Once a year.
Yeah. Now, if you have other conditions going on, then it's probably going to lead you to have to go somewhere between quarterly to every other month, depending on what your situation is.
Right. June is also the beginning of summer. And how about your medication that the doctor prescribes? They write the prescription to you and you give it to the client or patient. What about the heat and the medication? Should we be aware of that?
You should. I would encourage everyone, do not leave your medication in these hot cars. Even when we get the medication, we are encouraged to store them at a certain temperature range. And certainly with cars, temperatures getting above 100, that's well outside of the range where we can guarantee the safety of the medication before it begins to break down and potentially become something poisonous. So if you need to do that, take it into work with you, but do not leave your medication in a hot car. Certainly your insulin, your blood pressure medication, any medication, even your supplements, do not leave those out in a hot car.
Let's go back to the mental health. And we don't think about that very often. But in fact, men are under a lot of stress. Any tips on alleviating some of that stress?
Yeah, absolutely. I would say that you need to begin to exercise because that is a great stress reducer. You need to identify what the stress is, whether it's the job or it's a relationship. Take a good, honest look at it. And sometimes hard choices have to be made. But what we try to do is where can we get you now? So I listen to the symptoms that they give me based on what they tell me. So if they're having racing thoughts or suicidal ideation, can't sleep at night, or hear voices, we generally kind of, tailor our therapy or our recommendations based on what we hear because mental health covers such a large gamut.
Right.
There's a number of things to consider. And guys, it's not necessarily just mental health. Sometimes it's tied to your hormone levels. Testosterone is a very important hormone. And if it's low or too high, that can affect your mental. I mean, some things, even like chronic pain, can affect your mental health. Right. Because if you're not feeling great and you're hurting all the time, you're not going to be the best maid or parent that you could be because you have this constant nagging pain. So what I try to do is get a deep dive to see what's going on with you because sometimes what you're telling me, may not be it. So for instance, when men come to me, I'm having problems, man, I can't sleep. And, so normally you would think that they have insomnia, they have depression or anxiety. Not necessarily the case. So I always ask them, what's your sleep hygiene like? How many times you getting up at night to pee?
Right.
And so it turns out it may be your prostate. That's right. Not necessarily mental health. Mental health is very important. It's being destigmatized right now. But gentlemen, I would encourage you to talk to someone, if not me, about some of the things that go on with you, because sometimes the answer is just in talking to someone else.
Should men be more aware of their mental health than women?
Well, I would say, everyone should be aware of it. It's just not been comfortable for men to address it. Yeah. And so we're here to say, yes, it's important. It does exist and you need to deal with it.
Does it have anything to do with testosterone?
It does. Absolutely. Yes, sir. And so those things need to be monitored, and we have things that naturally raise it. So because that can affect your mood, also affects your health. So yeah.
Well, gramophone line 615-737-9292. If you have a question for Dr. Sean Pruitt, he is a pharmacist and herbalist, and we're talking about your health, especially men's health. And of course, you can go to YouTube or you can go to Let's Talk Nashville and call us 615-737-9292. Ask the pharmacist. The pharmacist is on call and we're waiting for you. 615-737-9292. Let's go back to the medications and the fact that we have to, if we need to, if the doctor recommends it, but I'm sure there's some other protocols that we can take other to combat diabetes or any levels like that.
Yeah, absolutely. Ern, as you know, in our 12-year history, we have been big on educating people to take care of themselves on the front end. And you can't always do that without going to see a doctor. You can do that without going to see your doctor. So we have a lot of natural alternatives for pretty much everything from A to Z, and lifestyle modifications that you can take to improve your general health. So we talk about diabetes, for instance.
Right.
Our flagship product is called beetroot juice. It's the number one seller. In fact, I'll say it's done so well that we have bought out the two major companies nationwide. There is no more. There hasn't been any since January. We're on our third company.
You're
diabetic or hypertension. So what it does, it provides the pancreas what it needs so it can begin to function properly. Your pancreas, if it works correctly, guys, it's supposed to secrete insulin. Okay. And so what that insulin is the key to let the sugar take it out of your bloodstream and into your muscle tissues and into the cells so they can perform its function. In diabetes, that key is not being produced. And so the blood just circulates in your blood, which is why we test your blood to see how high your sugar levels are. In hypertension, it opens up your vasculature, opens up the vessel so that the blood can flow more smoothly and the heart does not have to pump as hard. So it also helps with liver disease. So it helps with a number of different conditions. But that's easily our number one product for people to begin working on their health.
And Pruitt's Discount Pharmacy has that, of course.
Absolutely.
All right. Let's talk about what is happening with hypertension.
Hypertension, as you know, the silent killer. Many causes: diet, life stresses, testosterone levels, so different things like that, mental health status, chronic pain, all those contribute to having hypertension. And so I usually do a deep dive to see what's going on with you, and then we kind of figure out where we need to attack hypertension. But again, beetroot juice will take care of that, encouraging a person to eat a lower sodium diet, less processed food, eliminating the sodas. Absolutely. Disease begins in the gut. So if you stop in the intake of sodas, which are high in sodium as well, then you'll begin to knock your blood pressure down. What I love about my patients is once they start seeing a little bit of something, they easily do the lifestyle modification because they love how they feel on the beetroot juice, on the alkaline water, on all the other stuff that we do. So the work is on them. So I don't take any credit. The people who get the success stories, they put in the work. Those who don't, the bottle's still sitting there unused. Hey.
So if a man or a woman go to the doctor, and the doctor says you have hypertension or you're a diabetic, then of course prescription is issued. Will the summer months affect any of these prescriptions?
In terms of what?
In terms of high blood pressure, let's say.
Well, the summer months, again, just not dealing with the temperature, but that could also push your blood pressure up as well. But what I would say is don't necessarily just take the prescription. Find out what the cause of your hypertension is. So you're going to have to take a look at yourself. Am I eating the wrong types of foods? Is there a stressor in my life? Is my mental health on point? Are my estrogen or testosterone levels together? Because, we don't want it to just you thinking it's a quick fix, because we have so many people who've been on blood pressure medication for decades and either staying at a flat curve, but never getting better. So my patients, I encourage them to do the lifestyle modifications, take the things that they need to, and they get the improvement. They had a number of people come off the medications just with lifestyle modifications and the beetroot juice.
I guess what I'm asking is, because of the heat, and we're getting excessive heat all across the country, should we take our medications at night?
No, it has nothing to do with it. So you could take your medication at night if it's going to affect you, during the day. But you're still going to need your blood pressure lowered during the morning if that's when your blood pressure is the highest. So no, that doesn't factor in at all. I would say some medications make you photosensitive to light, and so you should probably limit your exposure to the sun. So those of you who take like hydrochlorothiazide, which is a pink fluid pill, it's going to make you sensitive. Those of you on doxycycline, those are going to make you sensitive. You're going to feel weak, a little nauseous and sick because of the increased exposure to the sun. So not the heat per se, but exposure to sunlight.
615-737-9292. Ask the pharmacist, Dr. Sean Pruitt. Pruitt's Discount Pharmacy is our guest. Ask the pharmacist, and the pharmacist is on call. 615-737-9292. Or you can post your questions or your comments to Let's Talk Nashville. And of course, if you posted a comment, Doc, we have a few. Let's go to your screen now. And from Ms. Long, she says, I hope men are listening because we are having so many men that sometimes we're losing them to something that could have been prevented. Are most illnesses preventable?
Yeah, from what I've seen, most are preventable and most are easy to change. And so that's the thing of why our following is so strong, is we don't come in and give you a whole bunch of complicated things to do. It's very simple. It's mostly inexpensive, and you get results quickly. This is not something that you have to do over a period of weeks. You're going to get your first result anywhere between the first day and the first week. But yeah, she's absolutely right. We're losing a lot of brothers to things that are preventable. So we just have to educate them. Look, there is something you can do, but we've been taught to think that, oh, if I've got high blood pressure, I'm going to have it forever, or diabetes, I'm going to have it forever, and that's just how it falls in my family and all of that. No, we can break that generational curse. But it starts with you. Finding the knowledge that you need to do something about it, and the will to change certain habits. Y'all notice I keep saying that it's not all on the herbs to do it. There's lifestyle modifications that we have to do. So with those of you,
and the medication,
absolutely, medication is prescribed. But so for those of you who are diabetics, and you say, because they constantly come and they say, well, I'm sick of this insulin. Well, I ask, what do the nighttime meals look like? And if they tell me it's full of carbs, then I have to educate them, because nobody else has, that those things turn into sugar in the morning. And so my patients, we cut all that out, and their sugars go down next day, the first week. So diabetics out there listening, we're going to have to eliminate bread. We're going to have to eliminate potatoes, rice, all those things that convert into sugar in the morning. If you didn't know, now you know. Okay. Those you can eat for breakfast and lunch, because you're still moving around and burning that sugar. But if you eat those things at night while you're laying in sleep, it's going to turn into sugar, and your blood sugar is going to be high the next morning. So you can come off of insulin. You can come off of the metformin and the glimepiride with beetroot juice and with the lifestyle modification. Something simple as just eating at the right time.
You are what you eat.
Absolutely.
Stay away from high carbs and sugar.
That's right.
And that'll take off some of the weight.
Yeah. I have so many who feel they need to cheat with sweets, and say, oh, look, I'm not a control freak about it. I know you need to reward yourself sometime, but don't make it every day. So absolutely on the weekends. Hey, definitely.
615-737-9292. Ask the pharmacist, Dr. Sean Pruitt. Pruitt's Discount Pharmacy is our guest. You can post your questions if you have one for the pharmacist, the doctor. The doctor is in. 615-737-9292. Last time we talked to each other, we were talking about COVID-19. And you have this potion called Pruitt's Potion. How's this still going?
It's still going strong, because COVID is still out there. It's just not being, advertised.
COVID is still on.
Oh yeah. And I forget the name of this latest strain, but we are still selling a lot of potion for COVID and for the allergy sinus season, because a lot of people are saying it's helping with their allergies and sinuses. But everybody, COVID is here, and then it looks like we're getting ready to have a bird flu pandemic as well, or we're at the beginning stages of one, whether or not you know. So it is best to get something that's going to protect your immune system. COVID-19 did a number on us. Dr. Pruitt's Potion did a number on COVID-19. So while we were able to sell it on Amazon, it had 5-star reviews nationwide. Now we just sell it directly out of the pharmacy. We've saved tons of lives. Their words, not mine. So I would encourage you just to have this stuff on hand. So, when you get sick, you can knock it out within a day or two, because this stuff works quickly. Dr. Pruitt's potion. That's
What
right.
about the ones that we get in shots?
Well, I mean, you can do that if you want to, but now the literature is coming out that that wasn't necessarily the safest option or the most reasonable option for patients to take. And I believe we did a show about that a few years ago. And we're beginning to see large numbers of cancer cases. We're seeing large numbers of people dying very early from cardiac deaths. I mean, but all so yeah,
From the vaccine.
absolutely. So the COVID vaccines have kind of fallen out of favor a little bit. And I know at my pharmacy, only one person has asked about it. Most people have opted to go with a potion to take control of their own immune system. But guys, you have to remember that the shot was made to mimic the virus. Okay, and so that means it's going to cause that clotting and all the side effects that people are dying from. It mimics COVID-19 disease. And that's because you're using the spike protein to trigger an immune response. So they were de facto giving people COVID and, and hope that they built up immunity to it. But not everybody was, that was not safe to do in everyone. And that's why we're seeing all of these spikes in cardiac, even in young people who should not be dying of cardiac deaths in my age range and younger. So all these mysterious deaths, the jab.
615-737-9292. Ask the Pharmacist. Dr. Sean Pruitt of Pruitt's Discount Pharmacy is our guest, and he's here to help you live a better lifestyle. Cut out the carbs, cut out the sugar. It's a modification on your diet. Again, you are what you eat. If the doctor prescribes, do you also suggest taking some other protocols, natural herbs or whatever, to go along with the prescription?
Yeah. What you also have to realize, some of these medications, guys, can deplete the vitamins in your body. And so sometimes we will suggest, so if you take, for instance, the statin group, they will lower your coenzyme Q10, which we need to regulate your blood pressure. All right. And so we will suggest that, hey, maybe you want to consider this. Hydrochlorothiazide, furosemide fluid pills are going to deplete your potassium and your sodium. And this is why some of you begin to cramp. And I always ask, what did your doctor say your potassium levels look like? But if you're starting to cramp and I ask you if you're on this pill, then I know that your potassium levels, because you're peeing out all of your natural salts, and they need
to take extra potassium.
Well, normally doctors will prescribe it. If they don't, then I suggest potassium.
Do you get that from potatoes or bananas or fruit?
Yeah, you could do bananas, green leafy vegetables, a glass of orange juice. But I'd rather you get it naturally. And if it does, sometimes you need higher doses, especially if you're working outside and sweating a lot and having to pee because of the medication. But yeah, sometimes people need a little bit more potassium to keep them, because it's also good for your heart as well,
right? Not
just your muscles cramping.
Some people believe in taking daily vitamins.
Absolutely a good idea. Yeah, because you have to realize, unless you eat a perfectly healthy diet, a well-balanced healthy diet, you're going to be deficient in something, including me. And so supplements are to supplement the things that you should be getting from your diet, but you aren't. So that's why we take vitamins daily.
615-737-9292. Ask the Pharmacist, or post your questions on Facebook and on YouTube. Dr. Sean Pruitt of Pruitt's Discount Pharmacy is our guest, helping you to live a healthier lifestyle, especially during the summer months when you're working outside or you're outside working and you just grab a sandwich on the go. A lot of times you got to make those right choices.
Absolutely. But since you brought up a good point, hydration is probably even more important than that healthy sandwich. Guys, we are 75% water, and you have to make sure that you're putting the right type of water inside you, which is why at Pruitt's Discount Pharmacy we sell the Kangen alkaline water. So this is high pH water. It's easily absorbable, no chlorine or fluoride. We filter all that junk out, all right, so that you're able to digest this water. No taste, no smell. And our patients that have drank it, they have reported improvement in acid reflux within 15 minutes, gout, diabetes, hypertension, weight loss. So this water has done a number in making sure that people stay properly hydrated. Have to remember, water is very important. First thing you do when they get to the ER, they check your hydration status and pop some D5W in it, because most likely you're dehydrated. And so we have a saying in the Kangen water world that you're not sick, you're thirsty. And so we try to eat a lot of food to get the water that we're supposed to have. Let that A come from the fruits and vegetables you should have first.
Right.
All right. And then you supplement with things like the alkaline water. So it's going to require us to change diet to get the proper amount of water that we should get.
615-737-9292. Ask the pharmacist if you have something going on with you and you want an alternative or protocol. That being a natural herb or adding more to your diet or less to your diet. The pharmacist is here. Let's talk about the skin since this is the summer months, people out in the sun, and we hear a lot about cancer, skin cancer. Hey, what can we put on our skin for the summer?
For fair skinned individuals, sunblock that has a SPF of like 30 to 50 or greater. And if you're really fair skinned, you got to be careful about how you expose yourself to the sun. For those who have sunburn, we have a hemp lotion that we recommend people use. But again, it's about that exposure to the sun. If you're not heavily melanated, like me, it can do a number on your skin. So you have to kind of be wise and judicious. Sunscreen, yeah, I say something with a sun protective factor of, like I said, 30 to 50. Those help, to keep the exposure to the sun at bay.
All right, 615-737-9292. Ask the pharmacy. Something could be going on with you now. Perhaps you have a skin rash, and the pharmacist is here to put something on that for you. And do a lot of times people come to you as if, hey, doc, I know you got the cure. I don't have to go see my regular doctor. But you suggested always go see your regular doctor.
It depends, because a lot of things we're able to take care of fairly easily and get them the result they need. But I'm wise enough to know, all right, got a special situation going on, and this is going to require medical attention. They hate when I say that, but I'm doing this for your benefit. There's no ego about it. If I'm going to take care of you appropriately, then I need to be able to be honest with you and tell you, hey, this is something that we can't deal with. This is going to require an MRI or, something to that effect. But things like, skin rashes, I developed an eczema lotion, an eczema oil for that. And as bad as eczema is in our community, that stuff is really selling with us. So if you're out there with eczema psoriasis, stop by Prue's Discount Pharmacy and get free samples of the eczema oil. You see if it works for you, but most people say it works instantly.
I remember when hemp was coming to the market and you were one of the providers of hemp. Hemp is good for, seems like everything.
Yeah. Hemp is. There are about 100 plus chemical compounds in hemp / CBD, and each one of them has a different, from immune system to hormone modulating. We mainly use it for chronic pain. We use it for mental health conditions, since you brought that up. So it's good for anxiety, depression, schizophrenia, bipolar disorder, just because it's almost like a smart drug. It knows what's going on in the brain and it turns certain chemicals up or down. So we sell a lot of hemp.
Let's go down the list of the things that people suffer with and perhaps alternative protocol to take care of it. We've already mentioned blood pressure. We already mentioned sugar or diabetes. I have to say sugar. That's what the parents are telling us about. But lupus, what are some of the things you can take for that?
Lupus, I would probably recommend black seed oil. So you have to understand it's an autoimmune disorder where the immune system is attacking certain organs. So we need to tone down that bad part of the immune system. And that's what black seed oil does. It tones down the bad part of the immune system that begins to attack the body. And I think that that, along with hemp, for some of the painful conditions, I think that would be very helpful. And probably something like 5-methylfolate. Something like that would also be helpful. So,
black seed oil.
Black seed oil.
Beetroot juice. All right. And hemp, depending on your need.
Yeah. Sometimes it's painful for certain people, especially with the organ destruction. So we'll give them CBD as well to help with the inflammatory situation going on in the body and the chronic pain.
We know that June is Men's Mental Health Awareness Month and overall health. Dr. John Pruitt is here to help you, gentlemen. So if you have a question or a comment, post it on Let's Talk or on YouTube, or call us 615-737-9292. But overall health is both for men and women. Women are going through, it's sometimes you hear them say the change, menopause, things they can take for that, sir.
Yeah, our flagship product for ladies going through, menopause and weird menstrual cycles is called Lydia Pinkham. It's a 10 herb combination. invented by a lady named Lydia Estes Pinkham about 200 years ago, and that does very well for getting rid of those night sweats, the hot flashes, the mood swings, things of that nature. So we sell quite a bit of Lydia Pinkham. So no, all is not lost, ladies. And I know some of them think that's the case, but no, we've got some for you as well.
Some where the maybe estrogen pills.
Yes, yeah,
it could be cancerous or whatever.
Yeah, and we do see that some cancers do feed off of estrogen. So we have to be careful about some of the even the herbal protocols, because there are herbal estrogens out there that may also contribute to it. But I think that those things you want to take a look at dealing with the menopause symptoms, but also be screened for cancer to make sure that you're not, putting yourself at high risk.
You brought up the C word. Will we ever have something to take care of cancer?
Well, you would just want me to be frank about it. There are tons of cures out there. They just won't see the light of day. So what we do, I said there are tons of cures for cancers. They just won't see the light of day. All right. So this big pharma is not interested in that, So the powers that be are not interested in that. Cancer is a big money-making, money-generating machine. And so, no, coming up with something simple to take care of it just will not happen. And I'm not even sure if the will is there by anybody other than the patients to get rid of it. But what we recommend for our patients is something called apricot seeds. And so what it does is apricot seeds produce a small amount of cyanide, enough to choke out and kill the cancer cells, but in small amounts, not enough to hurt a human. So I'll say my biggest case was a lady who had 5 tumors on her breast. She came in pretty upset. So I sold her a bag, and she came back maybe a month later and said 4 of the tumors had disappeared, and the 5th one was shrinking. So she bought another bag, and I hadn't seen that lady in like 6 or 7 years.
Now, what was the name of these seeds again?
Apricot seeds from apricot. Yeah, so we sell them in packs of, gosh, it's a bunch of them. They're only $30. So for what it does, probably worth $3,000. So if you,
I've never heard of that.
Yeah, I know. That's why you got me on here.
Yeah, you're right. 615-737-9292. If you have a question for Dr. Sean Pruitt, he is a pharmacist. He's an herbalist, and he says there are things you can take that is preventable for a lot of things that are going on with us. We hear about the cancer word. We hear about high blood pressure. We hear about diabetes. We hear about lupus, sickle cell anemia.
Before I get that, I want to address the people that do have cancer right now, because apparently not being educated by their oncologist to avoid sugar. This is a contributing factor to you not getting well. So if you have cancer, you're going through chemo and you're doing all of that, you're doing nothing but feeding the sugar. With processed sugar, with any type of sugar, you're going to have to cut it out. Even if they told you can do ice cream on the weekend and fruit juice and all that, you cannot. You have to starve that thing to death. Okay, so it doesn't make sense that you do the other therapies and then you just refeed
so you
it.
eat a lot of salads or what?
Yeah, salad, green, leafy vegetables, smoothies. Probably avoid the red meat, but you want to make sure that if you're going to do chemo or radiation, that you don't give it strength to come back. So sickle cell. So,
well, before we get to that, we're on the C word.
Yeah, okay.
Cancer.
All right.
A lot of men, since this is again Men's Mental Health Awareness Month and overall Health Month, prostate cancer.
Absolutely.
Take some what kind of seeds?
Apricot seeds. Absolutely. Yeah, apricot seeds. So the chemical that is in apricot seeds goes by 3 names. It's vitamin B17, which was outlawed for some time here in the country. So it also goes by a chemical name Laetrile, Laetrile, or amygdalin. So these are just different chemical names of vitamin B17, which is found in apricot seeds.
So B17.
Vitamin B17.
How should you take it? Every day?
What I recommend patients do somewhere between 5 and 8 seeds a day, depending on how aggressive the cancer is. And you can either
like eating peanuts or something. Or?
You can do that, but I also recommend you can blend it in a smoothie. So if you got kale, spinach, and blueberries, then blend it in there with it and drink it down. If you don't want to be biting
themselves, which is a fruit.
Well, the apricots themselves are good, but it's the seeds that contain the amygdalin, not the apricot themselves.
All right. Apricot seeds.
Apricot seeds.
Perhaps a remedy to cancer.
Perhaps. It looks like it's doing very well. So I would encourage everybody to.
We talked about that before.
We have, yeah.
We have. It just went over.
Well, it's been a minute, so
Right.
yeah.
615-737-9292. Whatever you have going on. Dr. Sean Pruitt is here of Pruitt's Discount Pharmacy. Of course, he is an herbalist. He's a pharmacist. He's a doctor. He's also has his show, Pharmacist On Call. News Channel 5 Plus. You know, I want everybody to catch it from time to time.
All right. Yeah. First Thursday of every month, Channel 5 Plus. You can either catch it on the web if you're not local on Pharmacist On Call on YouTube, Facebook, and Instagram.
There are other ailments that affect people, men and women. Alzheimer's, dementia.
Yeah. No, I wouldn't necessarily give that. So we have to kind of see what's going on. A lot of that is attuned to like dopamine production or the lack thereof. And so those are slow degenerative issues. I would look at something probably like ginkgo biloba to feed more blood flow into the brain. And then probably, depending on if they're demented and the dopamine levels are high, then probably something like the hemp to bring the dopamine down.
Is there a grocery list people can get from you?
Well, there is, but they would need to probably come in and talk to me. I do 15-minute consultations. They're $35. So you bring your list of medications in, have your questions already, ready so that we can make it as productive as possible.
Wow, one-stop shop.
That's right.
Not Sean, but Dr. Pruitt's Pharmacy. 615-737-9292. Any questions, any comments at all you have, you can also post them on YouTube and on Facebook. Or call us, 615-737-9292. Dr. Sean Pruitt, he's a pharmacist, he's an herbalist, and he's here to help things I'm finding out and taking notes on. I need to come by with my grocery list as well. Is there something that everyone can take every day, like a multivitamin or something?
I wish there was a cure-all, but everybody has different issues. So, just in general, other than a multivitamin, men, probably something like a beetroot juice, because chances are you're suffering from hypertension, maybe diabetes as well. And I like beetroot juice because it also helps with the liver. It's our filter. And so those of us who like to go hard on the weekend or some of the medications that you take are affecting your liver, then beetroot juice will be good for that to help filter out all those bad things, help the liver begin to heal. You got to make sure your testosterone levels are what they should be. So I would probably recommend something like Endo-3 carbinol, which is a natural testosterone enhancer. Something for your prostate called saw palmetto, which keeps you from getting up so many times at night if you happen to go to the bathroom. But just as we age, those are just things that most, if not all, men are going to go through.
When you go to the doctor or your physician, if you will, and he prescribes a medication for you, are the doctors, maybe you know this or not, are they educated to know to say, well, I was going to give you some insulin to take care of your diabetes, but instead beetroot juice? That's not unheard of, is it?
Yeah, if you had asked me this when I first opened, I'd say absolutely not. So yeah, I got a lot of flack from the medical community, but a lot of them are buying in now because they just want the patients to get well. So some of them who listen to my content, they are recommending beetroot juice. Like I had one come in a few years ago, and he told me he was Dr. So-and-so, and he said, I kept asking my patients why all their A1Cs were going down, and everybody kept saying, this juice that you sell them. So he said, keep doing it, and I'm sending many more people over, which he did. In fact, he bought 2 bottles himself.
That was the beetroot juice.
Beetroot juice. So yeah, the medical community, I think, they are opening up to it, and this because the patients are forcing them to. They're trying to see, hey, how'd you get better? And the patients are vocal about, hey, this is what worked. I've been on metformin for years, and it didn't do this. I've been on this juice 1 or 2 months, and now my A1C is finally starting to come down. So I think the doctors are opening up, especially as we, more accepting of alternative medicine. You have a lot more of them now willing to take a look at it because in the end, they want their patients to be better. So they're going to want to equip themselves with all the tools to do that.
Do you make suggestions if a patient comes in and says, my doctor just put me on metformin because I'm diabetic? You say, yeah, okay, I got you on the metformin. Now, hey, try this beetroot juice. You make those suggestions?
I do make those suggestions. And, some people may not like it, but I'll say, hey, you can get rid of this, you can come off of this metformin in a month or so. I said, I want you to take it, but I also want you to take beetroot juice twice a day. I want you to eliminate those nighttime carbohydrates. And when are you going to see your doctor again? 2 months?
Late night snacks.
Yeah, mostly those. I said, but once you go back and see your doctor, they're going to see that your A1C is drastically improved, that your fasting blood sugar is drastically improved, because we want it to be the doctor's decision to take you off. But you've got to do the work to give them a reason to take it off, because they're looking at your blood. So you come in, that A1C is down, that blood pressure's down, they have no choice but to reduce your medication.
We should see a physician or a doctor once a year.
Absolutely.
Once a year.
Mm-hmm.
Now, he tells me, oh, this is high or this is low. I come see you, I get the prescription, I take the beetroot juice, and it's a natural protocol. Was any physician ever just said, skip the metformin, just go get beetroot juice?
I do not know, and I would doubt that, because we are taught to think a certain way as physicians, pharmacists, dentists. I'm probably the only one that just led the way with really being public about it. Now people are starting to catch on. So I would think it just depends on how brittle the patient is. I mean, if their sugars are 400 or 500, then they can start with the beetroot juice. But I think lifestyle modification is the biggest thing. They're going to need insulin kind of immediately to get them down. But again, even with those high blood sugars, I promise you, it is someone doing it to themselves.
Weight loss.
Speaking of weight loss, I did want to go ahead and put out there, I'm opening Pruitt's Wellness Clinic in a few weeks. This will be our starting as our weight loss clinic. So we will be doing the semaglutide injections and the tirzepatide injections. So I want to let everyone know we'll be doing that. Weight loss is very important. A key contributor to cancers, heart disease, chronic pain, because you're putting all this weight on your joints. And it's an epidemic here. I mean, I'll be the first to admit that I enjoy a good sweet tea and macaroni and cheese just because of the way we grew up in the South. But we do have to work on getting our weight down.
Right. Is there anything we can take to lose weight? What about some of these pills? Diet pills.
Yeah, the diet pills, phentermine, they do work in the short term. A little leery of that just because it raises your blood pressure. So I'm also concerned with being overweight and having heart disease. So that's why I took a look at the injections, the Ozempic Wegovy injections, and decided to do a compounded form because I didn't want to disturb the diabetics not getting their insulin. So what we have are forms that come from compounded pharmacies, and you just do a weekly injection of that.
Ask the pharmacist, Dr. Sean Freud. He's a herbalist. He's a pharmacist, and we're here to help you live better, help you live longer, if you will. Because June is not only just Men's Mental Health Awareness Month, it's the overall health. And every month should be an overall day to take care of your body. You cannot plan to do anything at all, if your health is your wealth. I always just like to remind people to do that. 615-737-9292. If you have any questions, any comments, you can also post your questions and comments on YouTube and on Facebook. We have a comment now, doctor, and it says, what do you suggest to help with acne on teenagers' face? It's a three-part question. We'll get to the other two later.
Okay, acne is going to be actually hormonal, so I'm not sure if there's anything that you can do about that. They do have a product called Retin-A, so I'm not sure about it, particularly the safety of it. It just depends on how severe it is.
Acne, blackheads.
Yeah, and as we begin to hit puberty, that's one of the hallmarks because our hormone levels change, especially with the young men getting their testosterone, ladies getting their estrogen. That I would probably defer to a dermatologist on that, since that's something they're going to see daily. I think it's just going to be a necessary evil. There are medications for it.
See it in the drugstore or something.
The benzoyl peroxide and all that, they're mostly going to dry it out, so I'm not sure how effective they are.
All right. Question 2, any suggestions for healthier gums and teeth without a lot of chemicals?
Other than brush and floss daily, it's going to be your diet. So you're going to have to eat a diet very low in sugar, and especially if you have dairy products, those things begin to sit and rot out the teeth. So you're going to have to make sure you're brushing after those types of things. Eat more fruit, more green leafy vegetables, because those things have the fibers that scrape the teeth and the gums.
Brush your teeth daily.
Brush teeth daily, twice daily.
Another question they wanted to know about was in regards to having a cyst on your face or something like that.
A cyst? that is probably going to require you being to visit a dermatologist.
Okay. If someone has a cyst on the face. Okay.
Yeah, and that's different from that, man. If it's a boil, that you can take care of yourself, especially like with gentlemen when we shave and we get razor bumps because our hair is curly when it grows back. Sometimes we'll get those razor bumps. So, guys, when you shave, make sure you wash your face good. Make sure you get something that will, an astringent that will dry out those oil pockets so that your hair can grow like it should without forming those bumps. So, stuff like witch hazel or sea breeze or alcohol after you shave, that'll go a long way to preventing razor bumps. But cyst, just in and of itself, a boil, other than bringing it to a head with a hot rag like they told you to, burst that. But make sure you're washing your face daily. Those can also come from us eating a lot of oily foods. So if you eat a lot of fried fish and all that, then you start to see that stuff come through the skin.
We have another question that's been posted to either Facebook or on YouTube. And the gentleman says he takes blood pressure medication, 25 milligrams. And he wants to know, what can I take instead so I don't have to be on these pills?
Well, yeah, I would a couple of things, and it depends on the type of hypertension that he has, because it's not all the same.
Losartan.
Losartan, then he could probably go with beetroot juice and coenzyme Q10 that will keep his heart from contracting so hard. So he's probably diabetic as well. Losartan also helps protect the kidneys from the effects of hypertension. So yeah, I would add the beetroot juice to what you're doing right now. Low sodium diet, and coenzyme Q10. Once you do that, and some potassium, magnesium as well. And once you do that, when you see your doctor the next time, they're going to remark how your blood pressure is lower. So beetroot juice, cap full twice a day on an empty stomach. So I would do it like right before your appointment. You'll see that your blood pressure is within normal range. He's going to reduce that losartan or eliminate it altogether. And
sounds like he's ready to just come off the pills, Mr. Nelson.
He can, because he's only on 25 milligrams. Losartan goes all the way up to 100. He's on a very low dose anyway. So yeah,
there's another medication called lisinopril. Any thoughts on that?
Lisinopril sometimes can cause issues. It was the original one that protected kidneys, but there's data out there suggesting that it may not be, the best drug for African Americans. You have issues with angioedema, which is that facial swelling and the lip swelling. And the cough. It causes a dry cough that's very irritating. So a lot of people have been switched to the losartan from the lisinopril.
Ask the pharmacist, 615-737-9292, or post your questions and comments to either YouTube or Facebook. Let's talk Nashville. Grab a phone line, post your question. Dr. Sean Pruitt is here. June is Juneteenth month, but it is also Men's Mental Health Awareness Month and overall health. Think about your health. Your wealth is your health. Grab a phone line, 615-737-9292. Everything is going on during the month of June, especially at summertime. And when it came across my desk that it was also Mental Health Awareness Month, so we need to talk about health. We need to have Dr. Sean Pruitt on, or Pruitt's Discount Pharmacy. Why is the weight loss? You say you're getting ready to open up a clinic. Why is it weight loss is becoming so important now? Shouldn't we just kind of push back a little bit?
No, I don't think so, because it's such a contributing factor to other health issues, and people, we're vain. We want to look good, and if we can find a solution that does not require us to necessarily work hard and exercise and do it quickly, then we're going to go for that. These drugs, these GLP-1s, are also good for reducing the blood pressure. So they do have benefit. Now, we'll say everyone is not a candidate. We do see some issues with thyroid cancer and pancreatitis. And so with my clinic, because a lot of people are given these products and no labs drawn,
right.
We're going to be drawing labs to make sure you're a good candidate for it. So we're going to check your thyroid hormones, we're going to check your pancreas enzymes, we're going to check a number of things just to make sure that you're a good candidate. And if you are, then we'll proceed forward. And if not, you will at least be forewarned, hey, this may not be a good option for you.
615-737-9292, or post your questions and comments to YouTube or Facebook. And Tony Ray has a question for you. And that is, he says, you're doing a great job with your analysis, but he's wondering how many times a week would you suggest being in their 40s or 50s to work out and with weights in the weight room? What about that?
That's a good question. So I would say 40s, 50s, about 3 times a week. Now, me, I'll go heavy and do maybe 5 days a week when I'm steady on. Right now, I'm at the 3-day-a-week cycle, and you can start that with light cardio. Yeah.
Okay.
Yeah. You'll get to be this buff. Yeah. So yeah, I get into the weight room. So do some mild cardio, so about 15 minutes of either walking or high interval, cardio. So run 1 minute, walk 2, something like that, and then get on your weight training. Now, in my early days, yeah, I'm trying to bench 315 and all that. As we age, we don't need to do all that. Your muscles will respond to higher repetition versus heavy weight. So now, instead of doing 10 heavy reps, I do 15 to 20 lighter reps, and I get more from that. So 3 days a week, T. Ray, Rue, if you the same person, I think you are.
Oh, okay.
I have one of my frat brothers there, and
you
then
guys work out together.
no,
Okay.
you actually pledged me.
Okay.
But so I would do that 3 days a week, and it gets some sort of cardio in as well, protein. And what I do is I do intermittent fasting. So I don't eat anything till like 12 on my workout days. So that way, when I do exercise, it's burning up all that fat and sugar that I had left over from the day before. And
Now, our producer Sean Good goes to the gym, but I think he goes every day. I'm not quite sure.
He's probably a young guy. Yes, he can do that. So yeah,
so let's do something that people or anyone my age, which is late 30s,
ish.
is walking. Something simple as walking and calisthenics, doing sit-ups, push-ups, things of this nature. Does that work?
It does. Yeah.
You have to go to the weight room with you and T. Right?
No. No, you don't have to go to the weight room. Your body is heavy, and so walking is great. I think there was a study that showed it was just as effective as running, and I agree. It, especially in this heat. And then you can do calisthenics. You can do the Nautilus machines using your own body. That is absolutely a pretty good alternative.
All right, but exercise
in general, yes, great for your mental and physical.
Every day or every 2 or 3 days? What?
I would say the walking maybe 5 days a week, but actual physical exercise, resistance training probably needs to be about 3 days a week.
June is Men's Mental Health Awareness Month. Overall health. We're talking your health is your wealth with Dr. Sean Pruitt. He is a pharmacist and an herbalist of Pruitt's Discount Pharmacy. Soon to come, and we're going to talk about losing weight, and you going to see him to lose weight. And we have some equipment in some of the clinics so people can work out.
No, it won't be that type of deal. No, they will be given a diet plan to follow. They will be, given an exercise plan. What we were seeing in the people is a lot of them were losing the weight, but they would be kind of flabby because they lost more lean muscle mass than actual fat. And so what we wanted to do is make sure we keep people in positive nitrogen balance. So you'll be given a diet plan, you'll be given a resistance training plan, so that as you begin to lose weight, you're going to tone up.
You hear this at the beginning of every year, New Year's resolution. I'm going to lose more weight. I'm going to get healthier. But the first thing we need to do is change that diet.
Oh yeah, absolutely. And you don't have to necessarily eliminate everything. I tell most of my patients, just cheat on the weekend, get it on over with.
Yeah.
Get your cake on out of the way, and then Monday through Friday, you just do good. Again, watching those nighttime carbohydrates, and allows you to enjoy something.
So no carbs. It includes rice, potatoes,
absolutely not.
Pasta.
So
none of that.
2 groups of people: if you want to lose weight, and if you want to bring your blood sugar down, those are no-nos.
What about sugar itself?
Processed sugar is just bad. It's probably the number one most addictive drug in this country. It beats cocaine easily, beats meth and fentanyl easily. Sugar is the number one addictive drug.
You put it in your food to season it or mix it with Kool-Aid.
Spaghetti and everything else. Yeah. So I would say you just got to have some sugar, depending on what you're taking. Raw honey, something like that, or you can do maybe pure cane sugar, but certainly not the processed domino and all of that stuff. And certainly, and I know some people think that taking some of the artificial sweeteners are good, but it looks like some of those can lead to brain lesions, cancers, and other things. I'd rather you just eat raw pure cane sugar than that stuff. So if you're
Not use
Splenda, no. Stevia, no. Sweet and low, no. None of that.
equal.
Aspartame kills your brain. No, none of that stuff.
Wow. But yet still it's being run off the shelf.
Yeah, it's being marketed. I told you now that there
When
are
I was
several.
trying to lose a little weight, I would use one of those artificial
Yeah, that's fine. But most of us are addicted to them daily, and we're using more than 5 packs a day. So
So what's a good daily routine?
depends on the person. So there is no one size fits all.
Get up, do a few exercises,
Yeah, I do.
start your day running around the block. What?
Now, I've done both. In my younger days, I would do the morning and evening shift with exercise. Right now, being an entrepreneur, the morning works better for me.
Right.
So I can get up, hit that, and then, hit the office. But it just depends.
Give me an example of a diet. They say you eat in the morning, you eat like a king. In the afternoon, you eat like a prince, and then at night, you eat like a pauper.
Depends on your blood type and your body type. So me, I guess I think I'm called an endomorph. So I gain muscle mass easily.
Okay.
So, I could be in the gym in the first week and you're already going to see the results. Most people, it's going to take them weeks. So I would say a good routine for me. No, sir. No roids. Will also lead to cancer. So
Steroids.
yeah,
Wow.
will do. So one of the things that you can do is start out, eat a good breakfast on my workout days. After I work out, I'll come in with a smoothie, spinach, kale, blueberries, banana, maybe some ginger root, and probably some beetroot juice.
Now, fruit has a lot of sugar in it.
Yeah. Some are high in sugar, some are lower in sugar. So watermelon is pretty good. It's
all that stuff.
Yeah.
Peaches,
Peaches probably higher, grapes probably higher on the glycemic index, but that's why I do blueberries, instead make strawberries, something that are not really high sweet. So you won't see any tangerines and all of that in my smoothies, just because they are, high sugar.
Mm-hmm. And that's the number one killer.
Yeah. Well, not the natural sugars, but the processed sugar.
Right. We need to get sugar out of our diet, carbs out of our diet. Should we just go on leafy vegetables and salads, or what?
If you are a blood type A, yes. But if you're a B or an O, then that's not going to necessarily be the optimal diet for you. Right. So your O's, they,
we want people to come and see you and talk to you, and let you know that, hey, I'm taking Larcenitan or whatever. Oh, okay. Now try this. But we need daily routines because we're a creature of habit.
Absolutely. So that's why I don't make it hard. I suggest one or two things. And once they begin to work, then most people come for, more information, more things that they can do. Sometimes we get overloaded with information. One or two things, of course, they're going to work. And then, we'll
let's
see.
look at the reverse. Mm-hmm. People who are trying to gain weight. What do you think of that? What should they do?
Resistance training. You probably need to increase your
powders and stuff.
Yeah, protein intake. And then there is a supplement out there called apetamin, APETAMIN, that stimulates your appetite. So you could do something like that. Or if you have a prescriber, he could write for something called cyproheptadine, 4 milligrams. That will stimulate your appetite and make you want to eat more. But it's going to, require you to do some resistance training so that you can build your lean muscle mass up.
Before you go, let's more or less recap on healthier lifestyles. Again, see your physician at least once a year.
Absolutely.
And then if he gives you a prescription, come to Bruce, get it filled, and take a supplement.
Yeah, if you need one. So I'll have to ask you a certain set of questions. So no, it's not and that's the thing about my practice. It's not cookie cutter. It's always tailored and individualized. Mm-hmm. Some people may not need a supplement. Some may need more than one, but it requires me talking to you more than the 5 or 10 minutes that you might get in your doctor's office.
Are we finding just as many people that want to gain weight as people that want to lose weight?
No, I do have some. I do have some that ask. Most of the ladies, they want to, thicken up. But by and large, everybody wants to lose.
Right. What are these injections?
Yeah, that's what we'll be doing. I'm looking at the results, and they seem to be doing very well. We do have some people who do have some health issues with some of the side effects, but by and large, it looks like people are doing really well with them. I wanted to offer it in our community because we have an issue with trust sometimes. And so I think that someone that the community trusts needs to be offering this, but also monitoring everything that could go wrong. That's why we're doing labs as well, so we can make sure these things are being done safely. Instead of you just going somewhere and they injecting you, we want to make sure we're looking at you and palpating your thyroid and making sure that this is going to be a safe alternative for you.
We always say you are what you eat. Let's not picking on anyone.
Mhm.
Let's look at people who are vegetarians, vegans, if you will. Do not eat meat. Do we need meat in the diet?
If you are blood type O, you need meat in your diet.
Beef, pork?
No pork. No, under no circumstance are you supposed to be eating pork.
Okay.
That's just religious and health wise. You're not supposed to be eating that.
Meat? Beef?
Yeah, ground beef and
Fish,
pork.
chicken.
Absolutely. Chicken, for those of you who are type Bs, probably more so fish and grains and avoiding chicken. Don't get mad at me. So it just depends on your blood type.
The pork council gonna come after you.
I mean, I don't care. Yeah.
But of all the meats, stay away from pork.
Yeah, absolutely.
Sausage, bacon, all this stuff.
Yeah, laden with parasites, and there are turkey alternatives to that anyway. So I mean, you come in with hypertension and cholesterol, the first thing your doctor's gonna tell you is to lay off the pork. So that means
do you eat bacon? Do you eat sausage?
No, turkey bacon, turkey sausage.
Okay. Yeah. No, not you personally.
Okay.
Well, that's what the doctor would ask.
I'm not even sure if they'll ask. They'll just, in most cases, write the script and send you on your way. So that's why you need to go somewhere that's going to ask you the right questions, because a lot of people don't know. It's my diet. You mean I'm contributing to me being sick?
So the dairy products.
Dairy products probably need to be avoided too, even though I'm just going to confess to y'all, I am the biggest cheeseaholic in Nashville. I promise
Cheese
you.
on everything.
Man, if you put macaroni in front of me, I'm going to get it. So, but yeah, we do need to.
Macaroni, cheese, and pasta.
Ice cream.
Butter.
Yeah, we have to remember that stuff is mucus producing food, because it is mucus in and of itself. So when we're sick, guys, and we're having issues with allergy, sinus, COVID, flu, pneumonia, no dairy products, so no ice cream to make yourself feel better, no cheese, no milk, no cow's milk or goat's milk. Almond is fine. But yeah, dairy products do a number on us, causes inflammation. So you probably notice your nose running after you've had a good pizza the next day, or your joints may be a little stiff because dairy products trigger inflammation.
Okay. What can you put on your arthritis or rheumatism or sore ankles or?
Well, we've got something called.
When it's going to rain, how you know my knee hurts?
Yeah, we have the Pharmacist blend hemp, so I have my own brand of hemp oil and hemp lotion. That will get rid of that. Most people that I let sample it for free. In fact, free samples every day, everybody. If you're hurting, within 1 minute, they say the stuff is reduced or gone.
Question that's all from YouTube or Facebook.
Yes, sir.
It says, do you offer services for females for a basic vitamin regimen?
Yes. Yeah. Tell them come see me.
Like, what do you mean? What are you going to recommend?
Well, we're going to see what's going on with her first. So she tells me, I got numbing and tingling. So I already know she's probably low on vitamin B12. Oh, I'm just so tired all the time. Likely, especially depending on menstruating years, she's going to be low on iron. So we've got to replace the iron that she's losing from the blood during her menstrual cycle. So all these things require discussion with the patient. It is never just because they're female or male.
Well, what can you take if you get a tingling or numbness if you sit too long, or you say, oh?
You can stand up, move around. See. And then she's what it is. You're restricting the blood flow to the body.
Is that a health problem?
No, it's just acute.
Man,
it's acute, man. Just get the blood moving, wiggle your toes, and you'll be better in 2 minutes. No, that doesn't require any kind of herbal or medical intervention.
Right.
That's all you got to do.
Okay, so exercise daily. Walk around the block, if nothing else. All right. Stay away from sugars, pastas, carbs, What else will we stay away from?
If you are diabetic and or trying to lose weight. I'm not talking to
If you're
everybody.
not diabetic, you can have the macaroni and cheese.
Yeah. But these are people who are wanting to correct the situation. And I'm telling you, this situation is the cause of the issue. Yeah, so don't talk to me about it.
Where you located, Doctor?
811 Dickerson Pike. We're in Suite C next to the Z Mart gas station on Dickerson Pike. So right by the Buffalo, y'all, a mile from Titan Stadium.
Any other location?
Yeah, we've got 3 others waiting to put pharmacists back in them. So we've had some of our pharmacists take other opportunities. So we're looking to reopen our Casey, our Napier, and our Antioch location.
All right. The main location is Gallatin Road.
Dickerson Pike, yeah.
Dickerson Pike.
Yes, sir.
All right. And what's your hours of operation?
9 to 6. Today we're 12 to 4. So y'all probably won't get there. And by the way, the beetroot juice has not come in, so you all can come in for that tomorrow.
We'll get to that. Yeah. Beetroot juice. Take that daily?
Twice daily, yeah. So first thing in the morning on an empty stomach and right before bed.
All right. Apricot seeds.
5
Take
days.
it daily?
Yeah, daily.
Okay. What else do we need to take daily?
Again, depends on your situation.
All right. We're living a healthy lifestyle.
Yeah. And for those of you who have issues with your kidneys, we've got good results with burdock root. So it helps your kidney function. I've had a number of people avoid dialysis. So you can get on some burdock root for your kidneys. For those of you who have
What kind of root?
burdock, BURDOCK. We sell a lot of that. And pumpkin seed oil for those who have bladder issues, constantly having to go to the bathroom, men and women. Pumpkin seed oil does a lot to slow down those bladder contractions so you don't have to pee all the time.
Healthy lifestyle. Live healthier, live longer.
Absolutely.
Well, no man knows, but you can try.
That's right. That's right.
Preventive medicine, if you will.
It is.
Doc, you're great.
Yes,
again, get some COVID-19 is still around stuff.
Yeah. COVID is still here, and you can look around. The hospitals are still going through it, and just people in the community, they're still going through it. So get some Dr. Pruitt's potion. If not for COVID, then for allergies and sinuses, and it'll help all 3.
Okay. What days you open?
Sunday through Friday, 9 to 6.
Sunday through Friday, 9 to 6.
Well, Sunday 12 to 4, but Monday through Friday, 9 to 6.
Saturday?
Yeah, we're observing the Sabbath, so I don't work, neither do my people.
All right. My man, Dr. Sean Pruitt, he's a pharmacist and he is an herbalist, and we want you to be healthy as we go through the jingle. And of course, you have an open invitation always to join us so we can live a healthy lifestyle, Doctor.
Thank you, sir.
All right. That number again to your office.
615-562-MEDS, 562-6337.
All right. Catch Dr. Sean Pruitt on News Channel 5 Plus. Pharmacist On Call.
First Thursday of every month, 7 p.m.
Thank you for being here for a new format.
Thank you for the invite.
All right. Dr. Sean Pruitt. Your health is your wealth. June, Men's Mental Health Awareness Month, and overall health. Live a healthy lifestyle and you'll feel good about yourself. You'll feel a lot better. See your physician or personal doctor once a year. If he gives you a prescription, go see Dr. Sean Pruitt. And then, of course, he may have something else you want to take on the side.
Absolutely.
Just a little extra icing on the cake. Wrong analogy.
No, but that's all right. For ED, we've got something called Legend, works 4 to 5 days. So, gentlemen, come see us.
There you go. You're the man. Dr. Sean Pruitt, thank you so much, sir. As always, remember to respect your father and your mother. Love your brother and teach your sister how to be a lady. On our next episode, unfortunately, we have to talk about violence in the community again. People are losing their children. No parent should have to parent their own child. That's on our next episode. Let's talk live on YouTube and on Facebook. It's been our pleasure. We hope it's been yours.
You've been listening to Let's Talk with your host, Ernie Allen. The views and opinions expressed on Let's Talk do not necessarily represent the position of this radio station or management.